Well, good afternoon. I'm King County Executive Dow Constantine. We've reached a critical moment in the long fight against the pandemic, one that will determine how quickly and how safely we will emerge. Hospitals in King County and all across our state are at their highest occupancy rates, admitting more COVID-19 patients now than at any point since the pandemic began more than a year and a half ago. In fact, earlier today, Public Health Seattle and King County had to provide guidance to our region's hospitals on how to plan for additional morgue capacity. COVID continues to adapt and become stronger, and so must we. The good news is we have effective tools now that we didn't have at the start of the pandemic, including safe vaccines that are free to anyone 12 or over. And because 85% of King County residents have received at least their first vaccine dose, among the highest of any major metropolitan region in the country, we're able to apply a verification policy that will keep people safe and keep businesses open. Today, I'm announcing a new local health order. It will require proof of an approved COVID-19 vaccine or a negative test to enter certain businesses and venues beginning on October 25th. Our public health officer, Dr. Jeff Duchin, will provide details in a moment, but this health order will apply to these main categories: outdoor, recreational, and entertainment events with 500 or more people. So that's including professional and college sports and concerts. Indoor recreational and entertainment establishments, regardless of size, including performing arts centers, movie theaters, gyms, and convention centers, and indoor restaurants and bars. We developed this policy after conducting extensive engagement with a wide range of experts and stakeholders and community leaders, and they helped us develop a plan that is based on science, that keeps businesses open, and that promotes an equitable recovery. I want to make one point clear. The reason we are able to apply an approach that achieves these multiple goals is because the vast majority of King County residents have gotten the vaccine. Otherwise, we could potentially be looking at having to go backward and having another lockdown. I want to thank everyone in King County who has been vaccinated already, and I encourage everyone else who is eligible to do the same. Your life and your health and the health of our community and our economy depend on it. And I want to thank our healthcare professionals and our public health employees for their tireless work over the course of more than a year and a half to keep us all safe. And that includes our own public health officer. Please join me in welcoming Dr. Jeff Duchin.
Good afternoon. I'm Jeff Duchin, Health Officer for Public Health Seattle and King County. The Delta variant has fundamentally changed the course of our COVID-19 outbreak and how we must respond to it. The virus is airborne, and it's wickedly contagious, more infectious than earlier variants. It spreads readily indoors, and when masks are not worn, causes serious illness and is not adequately controlled. Washington State is experiencing all-time high levels of COVID-19 cases and hospitalizations. In King County, we continue to experience high rates of community COVID-19 transmission, with hospitalizations at their highest levels since January, and deaths are increasing. COVID-19 case rates are highest in 18 to 49-year-olds, and unvaccinated people are at greatest risk, especially for severe illness. Last week, 154 King County residents were hospitalized on average with COVID-19. That's one person hospitalized every hour. One King County resident is currently dying from COVID-19 every 8 hours. Over the past 30 days in King County, compared to vaccinated people, unvaccinated were 7 times more likely to be diagnosed with COVID-19, 41 times more likely to be hospitalized, and 42 times more likely to die from COVID-19 related illness. Our regional healthcare system is under serious stress and overloaded from increasing hospitalizations and critically ill patients needing ventilators to breathe, including an increasing proportion of younger adults and pregnant women, some delivering their babies in the intensive care unit. No pregnant woman should have to deliver a baby prematurely while on a ventilator in the intensive care unit, and no child should have to start their life that way, because COVID-19 is preventable through vaccination, the single best option for protecting individuals and our community. I want to thank Dr. Chris Murray's team at the University of Washington's Institute for Health Metrics and Evaluation, especially Dr. Ali Mokdad, Dr. Bobby Reiner, and James Collins, who provided us with a report that models the projected course of the COVID-19 outbreak in King County over the next 6 months and estimates the impact of vaccine verification for entering restaurants, bars, and gyms on COVID-19 cases, hospitalizations, and deaths. I'll briefly summarize the results, and I very much appreciate that Dr. Murray is here today to answer questions about the report. It will also be available online. First of all, it's important to understand IHME projects our outbreak to worsen in the next 6 months. In the absence of vaccine verification, IHME projects that over the next 6 months, there will be 300,000 new infections in King County, 164 of which will be diagnosed and reported, compared with 145,000 total reported to date. And there will be approximately 8,000 new hospitalizations, compared with approximately 7,700 total to date. And there will be up to 1,000 or more additional deaths. The peak of the winter surge is expected to be mid to late December. Now, on the other hand, IHME concludes that vaccine verification in King County will prevent substantial numbers of infections, hospitalizations, and deaths. Over the next 6 months, IHME estimates that vaccine verification at restaurants, bars, and gyms alone could prevent between 17,900 and 75,900 infections, between 421 and 1,760 hospitalizations, and between 63 and 257 deaths. That's preventing between 10 and 43 deaths on average each month from vaccine verification in restaurants, bars, and gyms alone. In the model's maximum effect scenario, vaccine verification could prevent up to 20% of infections, hospitalizations, and deaths. And it's important to note that the report does not include any health benefits of vaccine verification at entertainment venues or the large indoor or outdoor events where vaccine verification will also take place. And that's only due to constraints around the model, and that may be improved upon in further reports. It's also important for me to recognize that these estimates are based on the best currently available information and include a range of uncertainty, and they will be updated as new information becomes available about the epidemiology of the outbreak and the impact of mitigation measures. Now, clearly, our COVID-19 response must continue to adapt to the changing reality of the evolving pandemic. With Delta, the virus has gone on the offensive, requiring us to use layers of protection. Facing the reality of an unwanted, resurgent pandemic is difficult and unpleasant. I know you're all fed up with COVID-19 and the hardships that this pandemic has brought. I hear you. I'm feeling it as well. But if instead of taking stronger measures, we give in to fatigue and frustration, it's our own families, friends, and community members, particularly the most vulnerable, who will pay the cost, suffering unnecessary and preventable infections, hospitalizations, and deaths. And I know no one wants that. Most importantly, we need to pay attention to the number of serious infections and the resulting threat our hospitals are facing, and safeguard our healthcare system so you can get the care you need, including life-saving care when you need it and whatever you need it for, whether it's COVID-19, for a heart attack, a stroke, cancer care, or a serious accident. For these reasons, King County will require verification of full vaccination status or a negative test to enter outdoor public events of 500 or more people and indoor entertainment and recreational establishments and events such as live music, performing art, gyms, restaurants, and bars. These requirements will go into effect on October 25th for outdoor venues in the majority of the indoor establishments, and December 6th for restaurants with seating capacity of 12 or fewer who need extra time. And this gives people time to start their vaccination series or complete their vaccination series, and it gives venues time to prepare. Vaccination verification requirements will reduce the spread of COVID-19 in high-risk public settings, prevent COVID-19 cases, hospitalizations, and deaths, and help stabilize the healthcare system and return patient loads to more manageable levels. It will make businesses and other public venues safer for customers and workers and our community. And by decreasing COVID-19 spread, it will also decrease the risk to our children. And this is especially important until vaccine becomes available for those 5 to 12 years of age, which should happen sometime this fall. Taking these steps to stop the spread of COVID-19 now should also help reduce the risk of potentially more disruptive measures being required in the coming months. Now, I want to be clear that this order is not intended to be permanent. It will be reviewed periodically based on outbreak conditions and no later than 6 months after the October 25th implementation date to assess its continued need. But it will likely be needed until disease rates come down, hospitalizations are at a more manageable and stable level for our healthcare system, and more adults and children are vaccinated and protected from serious infections. Although the future course of the pandemic is uncertain, ultimately its impact on our lives will diminish, and we will live with this virus while limiting its impact on our health, our ability to do the activities we value, and on our schools, our businesses, and our economy. But COVID-19 is not going away soon, and we are entering what could be a very rough fall and winter with levels of transmission that are way too high right now. Along with wearing good quality, well-fitting face masks in public, improving indoor air through ventilation, filtration, and UV technology, through distancing and limiting high-risk activities, vaccine verification will further reduce infections and hospitalizations, save lives, and help get us where we all want to be sooner and more safely. I now welcome to the podium the Mayor of Seattle, Jenny Durkin.
Thank you, Jeff. Thank you, Executive Constantine. You know, from the very beginning of this pandemic, the city, the county, public health, the State Department of Health have been connected and speaking with one voice. But we wouldn't be able to do it without the residents and businesses, the healthcare workers of this great city and this great region. And we are here today to continue the partnership with those partnerships and to keep Seattle and King County safe. We've come too far, and it has been too hard for us not to do the right and smart thing now. We are the first region in the country to experience COVID-19. And I'm sure, as you recall, at that time we had a president who didn't believe in science and lack of national leadership. We had to decide how to respond to this once-in-a-generation challenge. So we innovated. We secured testing supplies from our international partners. We entered the Hunger Games to make sure our healthcare workers could have PPE and the supplies they needed. We launched a national leading testing program and infrastructure that passed over 1 million tests this week. We also launched vaccination efforts that reached hundreds of thousands of Seattleites and made sure it was based on equity. So those communities hit hardest by COVID-19, both economically and health-wise, our communities of color, would not be left behind on vaccines. And we did it with great partners, Swedish Hospital, Lumen Field, community-based organizations that did pop-up clinics. We pulled together to do what was right. And thanks to this work, Seattle continues to be the city in the country that is the safest place to be. We were the first to reach 70% of people vaccinated, and today nearly 80% of our population is vaccinated. But let's remember those early days, the horror we all felt when we saw those photos of people in senior homes and their family members putting their hands to the windows, not knowing whether they see their loved ones again. The most vulnerable population we have today are the people who are unvaccinated. They risk their lives and other lives. And the people who have no choice to be vaccinated are our children under 12. We must protect them so they do not become the next place that this virus is seen. We know this vaccine works. People without vaccine are 41 times more likely to be hospitalized. 41 times. 42 times more likely to die of COVID-19. And we also know where transmission happens. It happens in indoor spaces where people aren't masked and they're close together. Despite this beautiful weather today, it's Seattle, folks. The rains are coming. We will be going inside. We need to be safe. I really want to thank Dr. Duchin for this order today, but also for his work over the last 19 months. Every step of the way thinking about what was the right thing to do to keep people healthy and safe, but also do it in a way that respected what we need to do as humans to come together. No one wants to go backwards, and this is a way for us to continue to go forwards. It's the right thing to do for our businesses, for our small business owners, for our economy, and for our healthcare workers, so you will hear a few of them. If you've been watching the news, some states like Idaho and Montana, their ER rooms are filled up. Alaska, people are waiting outside for ER rooms. They send their patients here, on top of the patients they have to serve who are getting sick here in our region. Those healthcare workers need a break, and we have the ability to give them that. We know that this virus is dangerous, it's voracious, and it innovates. And we have to be smarter and innovate more quickly. This is something that everybody can do. And so, in brief, if you want to protect yourself, you want to protect your family, you want to protect the kids in schools and their teachers, you want to protect our healthcare workers, it's all the same answer. Get the damn shot. Thank you. With that, I'm going to introduce Cassie Sauer.
Hi, good afternoon. I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association. And I want to start by expressing just enormous gratitude to Dr. Duchin, Executive Constantine, and Mayor Durkin for this order. We think it is so visionary and so looking into the future and making sure that our hospital system is protected. Hospitals all across the state are under extreme strain right now. People are losing access to care that they need. We are delaying care for things like cancerous tumors, spine surgery, colostomy reversals, all kinds of things are being delayed right now, and it's a very serious situation. We're watching our neighbors. We're ringed by states right now that have gone into crisis standards of care. Crisis standards is rationing care. It's choosing who lives and dies based on the amount of resources you have. We want to do everything we can in this state to not have that happen. This should not be happening in America today with a pandemic that we can see coming and is preventable. And so the kind of action that's being taken here today by our county is tremendous. We call on other counties to take the same action. It will be very helpful to prevent the spread of COVID, which leads to hospitalizations and the huge strain on hospitals and deaths. So really just huge thanks to this county and urge others to do the same. I'd like to introduce Heather Likens, who is a critical care nurse and has been on the front lines of COVID. She's also a member of the Washington State Nurses Association, and she is here representing the thousands of healthcare workers that are on the front lines doing this every day, and so heroic and so exhausted from this pandemic. So Heather.
My name's Heather Likens, and I'm proud to be a critical care nurse here in Seattle and a member of the Washington State Nurses Association. Hospitals across the state are struggling to keep up with the influx of unvaccinated patients that enter their doors every day, and it is stretching healthcare workers like me to our breaking point. Working in the intensive care unit at my hospital, I need to be available to my patients in an instant, providing life-saving treatments and reacting quickly in emergency situations. I care for stroke patients who need my help to bathe and eat, and who are at a constant risk of falling and breaking a hip. I care for patients recovering from open heart surgery who need me at their side if their pacemaker malfunctions and their heart stops beating. I also care for COVID-19 patients. Some are on oxygen masks, unable to eat, sleep, or speak more than a few words as they struggle for days to catch their breath. Some are on ventilators, in medically induced comas, and will never see their families again. It's my duty to treat these patients the same, regardless of their vaccination status. But it gets harder and harder every day to look into the eyes of my patients, their families, and my coworkers and pretend like it's all going to be okay. More and more frequently, I'm expected to do the impossible and be in 10 places at once. Because hospitals are so understaffed, nurses, like me, are often unable to give our patients the care they deserve in their most desperate of moments. Throughout this pandemic, healthcare workers have become exhausted, angry, traumatized. Many have chosen to leave the workforce to focus on their own personal health. Those of us who remain want to continue caring for you and your loved ones, but we can't do it alone. We need everyone's help to reduce COVID-19 cases so that we can continue to care for every single patient. I want to applaud the steps that Seattle and King County have already taken to keep us safe. Because of policies like the one announced today, we have a shot at slowing the spread of coronavirus. Nurses and healthcare workers have watched with trepidation as large gatherings have resumed. Ensuring individuals together in indoor spaces and large events are vaccinated will help slow the spread and ease the tremendous pressure on our healthcare workers and hospital. This is about protecting our community, and we all need to do our part. Thank you.
Hi, my name is Todd Miner. I own Nana's Southern Kitchen in Kent, Washington as well. We opened up a brand new location in Covington, Washington. Nana's is based on the legacy of my great-grandma Myrtle, who used her food to bring people together. We learned so many life lessons working with her in the kitchen, and she had a unique gift of making sure everyone felt welcome. A key part of feeling welcome is feeling safe. At Nana's, we have an opportunity now with the vaccine verification mandate to continue to personify the great legacy of my great-grandma. If you choose to disclose your vaccinated status or show the necessary paperwork showing that you were COVID negative, you'll have the opportunity to dine in at a restaurant and experience a terrific service and outstanding hospitality. If you make a decision not to disclose your vaccinated status, or you choose not to disclose that information, you will continue to be served via takeout, a world-class takeout experience, one that we feel like we frankly mastered over the last 18 months. I mentioned my great-grandma. She taught us so many life lessons. One was like in times of uncertainty, times of strain, times of extreme pressure, find the space to be kind to one another. I invite each and every one of you to keep your community safe and take the necessary action to do so. I want to introduce Nate Dwyer from the Seattle Theater Group.
Hi, I'm Nate Dwyer, COO of Seattle Theater Group, home of the Paramount, Moore, and Neptune theaters. Seattle Theater Group is very happy to support this policy. Some weeks ago, as we were preparing to reopen our theaters, we implemented a vaccine and mask mandate. After being closed for the better part of a year and a half, as we continued to reopen and made our plans, we had to make a decision. Obviously, we wanted to reopen our industry, get artists and arts workers back to work after a long time off. And we also had to consider our obligations to public health as a community arts organization. Incredibly complex time to be reopening this business, but ultimately a simple decision for us. Taking this action mitigates risk. It mitigates risk of a terrible public health scenario, and it mitigates risk of us having to shut down again. We've been shut down. We don't want to do that again. So with this, we think we have made the safest version to allow our continued existence within the arts industry, and would invite everybody to participate in the arts, go out, visit a museum, come to a show, have fun, and know that you can do so just a little bit more safely. And with that, I will hand it back to Executive Constantine.
Continue to observe all the rest of the public health recommendations as well, to mask, to wash, to provide social distance, and ultimately together we can both protect health and keep our economy and our community moving forward into recovery. Thank you very much for being here today.